my friend Marcia. You will speak of TCM approach for children as preventive of chronic diseases in adults. You are a member of the board of ICMART, director at large for Brazil and South America. You are vice president of the Brazilian College of Medical Acupuncture, the Department of University of Sao Paulo, supervisor of the medical residency program of the Federal University at Sao Paulo, master degree in epidemiology by Federal University of Sao Paulo, scientific director of the Sao Paulo Medical Acupuncture College, head professor of the postgraduate courses of TCM acupuncture at the Federal University of Sao Paulo, head professor of the postgraduate courses of TCM acupuncture at the Center AO Research and Study Center as a professor. Okay, so at you, Marcia.
Thank you, Patrick. Thank you very much. Some titles have changed, but it doesn't matter. The important thing that we are here together today. And so, hello, everyone. I'm Marcia Yamamura from Brazil. And we will talk about today this TCM approach for children as prevention of chronic diseases in adults. Okay, so in the process of getting you, we know that many diseases initiate in childhood, right? And as a matter of fact, actually, TCM and the other ancient medicines, as Ayurveda, as anthroposophy medicine, they all consider that the period of the early and the middle childhood is very important. And some of them, like anthroposophy medicine says that the first 1,000 days of the child is very important. So at the Ling Shu, we can we can learn from them that describes sorry, that is the captions here is in front of me, sorry. Okay, just took. And it comes with the idea of the longevity and the brevity, okay, as a function of three main things. This emptiness and fullness of the qi and the shui, the blood, the insufficiency and the excess of the 5 zhang fu and the 5 zhang and the 6 fu, and the strength and the weakness of the xing, that is the form of the body, and the harmony with the mind. So for us to understand our development and, of course, therefore the development of the diseases, we can find at Suen the duration of 7 or 8 years, male, female, or male, you know that, of these evolutive phases of the body and its transformation, and how we can, preserve health with this. And by the other hand, and on the chapter 54 of Lin Shu, he uses from each 10 years to explain the duration of the different phases and the decline from the 50 years on. Okay, so of course, I presume everyone is familiar with this table, and if anyone needs it, I can send that to you. But it's according to 7 cycle and 8 year cycle of the boy and the girl. So the important thing that is at the age of 10, qi and shui circulates freely, and the children like to run and to jump. So if they have like a condition of deficiency, especially the yin deficiency, coming from, for instance, a prenatal period, they might manifest false young conditions as hyperactivity. And this can worsen with over, stimulation of the screen devices, for example, modern lifestyle, etc. So we should actually adequate the activities, the sleep, the cycle of sleep, and adequate the stimulation of the brain and in this special phase. By the age of 20, qi and shui are flourishing and the muscles are, awesome in the best shape. And that's why we like to walk in rapid steps. So when we recommend an activity for young people, young adults, right, we should recommend like running or even, not marathons, but running, it should be adequate. But at our 30s, the 5 organs are consolidated and it's stabilized. And now we prefer to walk with, slow steps. So these lifestyles that we live on today, that we run every day, it's not very healthy for us. At our 40s, our Zanfu are fullness and they stopped development. So the hair begins to fall, to get white, and we experience this familiar sensation of heaviness, dampness, lightness, and that's why we like to sit a lot. At our 50s, we diminish our liberty and of course, our vision. At our 60s, the heart chi, the shin chi is weaker and we are preoccupied and sad all the time. So the qi and the shui cannot circulate freely as they used to do. So that's why we need to lie down more often. Okay, so it's a secret of longevity, to lie down a little bit, especially after, some work or physical work or after having your meals. By the age of 70s until 90s, we will decline more and more until we have the kidney qi deficiency, and the other Zangfu will follow into insufficiency as well. By the age of 100 years, our Shen Qi disappears. I mean, we were born, to last at least 100 years, but something is happening that we are not, getting until the age of 100. This John Alfred, he was the oldest man, followed by João Marinho, that is a Brazilian, both with 112 years. And I don't know if it's a gossip, but anyway, there's one Brazilian that he's supposed to have 131 years old. Well, anyway, this chapter for 554, sorry, it brings 6 paragraphs about longevity and brevity, okay? And the first one is about fertilization. So what we know that the mother is the foundation and the father is the shield. So the union of these 2 genes from the parents, they form the first chi that we have, that is the Shen Qi, our consciousness. And because of these 2 genes, our ancestral genes, they are sufficient, we can, live until 100 years old, okay? Sorry. So actually, our longevity depends on the kidney qi, right? And the yang qi, because they are indispensable for the formation of the fetus. Okay, we have lots of going on during pregnancy, but especially the kidney qi and the yang qi is very, very important. On the paragraph 2 about the shame, the mental, okay, or our mental part, okay, we know that our first chi actually is consciousness, okay, and it's going to form Hun, Po, Zi, Yi, and Shen. These are the aspects of the mind that will lead to the formation of the Zangfu, and after that, with the participation of the extraordinary vessels, we are going to form the Xing, which means our body, okay? And all the energetic and structures related to the Zangfu will be formed. And it's a very important step or period of time during pregnancy, okay? So what we bring to you today, that is the vision of the idea of Professor Yamamura, his point of view, that our mental state and also the destructive and repressed emotions are the most harmful of all the factors of getting ill. And if they occur during pregnancy, for instance, they can lead to congenital malformation. So, what we know that what we experience in intrauterine period, we create memories and traumas, of course, and we learn from this, and we begin to function from these experiences and memories. Okay, so longevity and brevity of life have many factors involved to develop diseases. And if we have, solidity and firmness of the five zang, we have, free circulation of qi and shui, and the flesh will be fresh, and we should be healthy for many, many years. And of course, we have to have in harmony the circulation of both nutritive qi, yin qi, and the defensive qi, that is the wei qi, as well as a good and very good digestive function. So you have to preserve the spleen of all matters. What we know that the organic functions are conditioned to Sanjiao. Sorry, and we know that without Sanjiao, that is the triple burner, we have no life. So it's very important to take care, right, of the function of Sanjiao. And to have a long life, which means why some individuals live up to, I don't know, 100 years old, and some of that don't. So the Ling Shu brings the idea of the Chu Dao, which means that the narines and the nasal labial groove should be deep and long. Okay, so we observe since childhood, for instance, this part designates that the Dumai 26 should be harmonious, the circulation between nutritive and defensive qi. It also implies that the seven orifice that is related to each Zangfu that we're going to see in the next slide. Sorry. Okay. And it's the reunion point area of the Jing of the five organs. So if we have any ancestral issue related to Jing of the organs, we might have malformation, malfunction, or even disharmony of the Zangfu, leading to future diseases. So me, as a pediatrician, the Jing part of the organs of the Zangfu matters a lot to me. Okay, and then we can deal with this in order to postpone diseases as much as we can, right? And another concept is the three areas of the Sanli that designates the three palaces of the body, upper, middle, and lower. And these three areas should be, harmonic, even with the size of it. We should be proportional in our palaces, okay? Some feature as the chin and the facial rump part, okay, being square and the bones being very, very prominent and strong may allow us to live 100 years. Okay, like this. So we have this bony, type of face. It's better for us, and we should live 100 years, as it said. So in the fifth paragraph, Ling Shu bring us the problem of fullness and emptiness of qi and shui from childhood to death. So what we have actually is a progressive development, and after 50 years old, a progressive decline, okay? From 50 years from on, every 10 years, what we notice that we decline each organ according to the five movements law. That is to say, at 50 years, the Gan Qi and the Da Qi begins to decline. At the age of 60, the heart Qi gets weaker and weaker. At our 70s, the spleen qi subsides. And at the 80s, the qi of the fei diminishes. And at the age of 90, the shen qi becomes to be exhausted. And by the age of 100 years, all of qi, the qi of all organs become empty. And we die, of course. So if we analyze the beginning of the decreasing or consuming the qi of all the Zangfu, it may initiate during childhood according to the gene received from the parents, right? And of course, it's related to their lifestyles, their previous lifestyles, okay? So we may notice a kidney qi deficiency since childhood, just by noticing. Oh, these are some examples that the diseases may start at childhood, okay? And we may notice like the beginning of a kidney qi deficiency since childhood, okay? By noticing, the hair, okay, from a 2 years old and a 70-year-old individual, and they have like the same kidney deficiency, one of course, due to immaturity, and the other one due to aging, of course. But we can observe hair in children, babies that are born newborns without, no hair, and there's an information for us. Other alterations may, be noticed as a postural problems, and by scoliosis, kyphosis, and this is due to a problem of qi deficiency of the kidney, right? And of course, we are going to alter the anatomic paths, the muscles, the tendons, the fascia, etc. And this deformation probably began in early ages, okay? Another dysfunction of the Zangfu may manifest themselves as in the back or low back pain, for instance. We notice that in children, and mostly in children, we don't have back pain. It's not very common, but the disharmonies of the Zangfu will manifest as the back pain and low back pain, in adolescence, for instance, okay? Another example is the pain in the bladder 32, cilial. They may begin with the first menstrual cycles of the teenager, right? And the problem, the year of this teenager is small compared to the size of the head. And after that, maybe she will develop a low back pain, okay? And in the paragraph 6, it brings the questions that why some individuals do not know longevity and die. So this is related to our good qi, that is the qi absorbed from the food and the water and the food, right? And this good qi strengthens and consolidates our Zangfu. So that's why in the vision of Professor Yamamura, and I totally agree with him, that the two main factors that we have to be aware in childhood is the emotional factor, the emotions of the mother especially, and of course the diet. These are the two most important factors to promote health, right? And of course, to have a good relationship with food, not processed food, of course, it will, guarantee more or less the path, the way to maintain health. And of course, we can do acupuncture to children, babies, and teenagers. This is a photo. This is my patient, and you can see that she accepts very well acupuncture since she was a baby. These are patients from our service, our ambulatory, that we use some craniometric points from the system of Professor Yamamura to treat Zangfu. Children accept very well these points, craniometric points, and it's very useful, to give balance to the 5 organs, okay? So I finished my presentation and hoping to see you all in Antibes in the next ICMART Congresses. and I'm sure it will be a very special Congress. And if you need to communicate with me, or if you want to ask anything, means this presentation, you can take a photo of this QR code, and I will be available for you. So thank you very much. And I
Thank
think
you,
this is
Marcia.
it, Patrick. Thank you.